Hello, so this afternoon I want to be telling us about what will I be telling you about? Amenorrhea. You're not seeing your menses as a lady. Reacting to this question I'll be putting up there. Doctor, I have not seen my menses for a while, but I'm not pregnant. Now I want to tell you that there are things that may cause you not to see your menses, okay? One of it, or the most common is pregnancy. So when you're pregnant, obviously you should not what see your menses, and it's when you've not seen your menses for 3 months, it is called what, amenorrhea, right? Now pregnancy is good, but sometimes some people who are not pregnant also do not see their menses. Sometimes this is because the menses may be irregular, that it does not come after a certain days, right? And sometimes it will come late, the cycle length is long. So I want to tell you some things that make why this occur, or why you're not seeing your menses, even why you are not pregnant. Things you just have to pay attention to. Prevention, it may be the cause and may help you, okay? But before I start, once you have not seen your menses for 3 months and you are not pregnant, please see the doctor. It's very, very important. Well, have I had that experience before? I had it once sometime many years ago. For 3 months, I didn't see my menses, and I went to the hospital. I told the doctor, and I told the doctor, I was like, "Oh, you should have come, no problem." And then they will do some things, and they basically gave me a medication. They will give you a medication, a hormonal drug, actually. After they give medication, you take it for like some days, and maybe you take it for 10 days usually. After that, you bleed. Okay, so it happens sometimes. So going out to tell you some of the things you have to pay attention to if you are not seeing your menses and you are not pregnant. Okay, one of the things that can cause this is stress. If you are stressed, be it emotional stress, be it physical stress, it can make you not to see your menses. Okay, so you have to pay attention to it. If you're not seeing your menses and you're stressed, just relax and how do I say, relax, take your time, relax, and watch your body to see how your body responds. It may just come back even without you taking any medication. Okay. Another reason why you are not seeing your mens, you may not be seeing your menses when you are not pregnant, is exercise. You may be exercising, doing too much that the body can bear, and you are exercising and exercising and exercising. You may not see your menses. Okay. So if you are exercising a lot and it begins to affect your cycle, and you're having challenges with your cycle, you're not seeing your menses the way you ought to, what I would advise to you, cut down the exercise and see what happens. Peradventure, it will come back, okay? Another reason why people do not see their menses when they are not even pregnant is when you are underweight, like so much underweight, say 10% even underweight, okay? It may also affect the cycle. And that is why you see people that have eating disorders like anorexia nervosa, they tend to have issue with their cycle. Okay, so these things happen. So when it also happen, you have to also cut down, improve your feeding, and see what happens. Okay. Another reason why people do not see their cycle or do not see their menses are people with hormonal disorders, like people with polycystic ovarian syndrome. Okay, so they have abnormal level of hormones, and especially the male hormones. Okay, and that's why it affects their cycle. And then for them, what will happen is that sometimes the cycle can be long, and they will stay like, instead of 28 days to 35 cycle, can be for 40 days. 40 days they've not seen their cycle, and then when it comes, it may not even flow so much again. It will stay for another long time before it will come back again. But they also have other symptoms associated with it. I will tell you about that in my next video. Okay, we'll talk about PCOS. But this also may be a reason why you are not seeing your cycle. Peradventure, your hormonal level is what, down. Another reason, another illness that affects people's cycle is thyroid gland. They say gland here that controls the metabolism in your body. Okay, it produces hormone called thyroid hormone. When you have issue with that gland, either you have hyperthyroidism, okay, your cycle may be affected, and you may not see your menses when you are not even pregnant. And then another reason why people don't see their cycle is when they have something like a tumor, a benign tumor of a gland, pituitary gland in the brain. Okay, when you have a tumor of that gland, you can, if you press I will not use that word so that YouTube or Facebook will not catch me. But just look, if you press, you have discharge from here. All right. And then you have some milky discharge from there. It may also be a reason why you are not seeing your menses when you are not what pregnant. Okay. So when did someone have, and then it is called, the person gets what is called hyperprolactinemia, prolactinemia. The prolactin level is high. So that is it. Basically, another thing you should. I think these are the. I think have gone round. Have gone round. Another thing is premature menopause. Premature menopause means that you are not up to 50 or 51 years, but your cycle stop. Or they call, sometimes it's called. Okay, now we have primary ovarian failure and we have premature menopause. We have ovarian failure. The ovarian failure means you're not up to 10, 40, for instance, 45, and then you get into menopause. The ovary function goes down and stop working, and then you stop seeing your cycle. Another thing is premature menopause. This one are people, they are close to menopause, but it's around 40 years, okay, and then 40 and above, and their menses stop basically. So I think I've just said some of these reasons, some of the reasons that are why people don't see their cycle when they are not pregnant. What can you do when you stay up to 3 months and you've not seen your cycle? Please see your doctor. I know the medication you're supposed to take actually, but for some reasons, and because this is a social media space, and I've not seen you, I cannot say, I have not examined you, have not taken your history. I'm not able to prescribe any drug, but I would advise, if you wait for at least 3 months and you are not pregnant and you have not seen your menses, please see your doctor. It's very, very important. At least you know what is happening to you, what is wrong with you, and how you can manage it. Did you learn something in this video? Follow our page, and in the comment section, tell me your experience. I had that experience, or in Ukraine. Yes, I had that a particular experience. Maybe I can talk more about it in my next video. But that is it for today. Did you learn something? Follow, like, share for somebody. Share for your sister to see, for your brother's wife to see, for your boss. See you in my next video, guys.